Okay. Okay. Very good evening and welcome in the platform of Pharmalog. I, Dr. Shekhar Verma, Professor in Pharmaceutical Sciences, on behalf of the entire team of Pharmalog, I welcome you all, the eminent guests, and really it's a pleasure for us. We have a very experienced personality with us to discuss about our new series that is a Pharma Gurukulam. On the auspicious day of this Vasant Panchami and Saraswati Puja, we are proudly announce the initiation of this Pharma Gurukulam on 5th February 2022. Today we have our guest and the subject expert in the field of the which we have today discuss about the special subject that is defined and explored in the new syllabus of the diploma in pharmacy. Today we have a professor Dr. V. Gopal. Welcome, sir. We have
Thank you.
Dr. A.V. Yadav, sir. Welcome on behalf of whole entire Pharma team, sir. Welcome Rajvet sir, welcome Dr. Neeraj Upanyu sir, and welcome our most favorite and dynamic Dr. Saurabh Kose sir. Uh, First, I would like to explore the objective of this Pharma Gurukulam. Actually, the Pharmacy Council of India frame the syllabus under the regulation 7. They prescribe the equipments and the apparatus under appendix A of the education regulation 2020 for the diploma course in the pharmacy. And we all are the pharma professionals. We think when the pharmacy councils given a new syllabus, then we think the new subject, even if subject is a traditional, it should be reachable to the all the students. They should know what are the objective of a syllabus, what is the role of syllabus, and how we can understand the various topics or various themes of under the given in the syllabus. That's why we think we can arrange, or we can uh, fabricate one kind of the program where we have to explore about the subject. We can discuss what are the career opportunities, what are the role of a specific theme or specific topic in the present scenario, how students easily understand subject. That's why we had tried to gather the special guest in the farmer platform to discuss about various types of the terminology given in the social pharmacy. Today, we will discuss about the social pharmacy theory subject in the diploma first year. And one announcement that tomorrow, that is on 6th February 2020, on Sunday, in the platform of the Pharmolog, we will discuss about the social pharmacy practical subject. And one more, my colleague and my friend, that he will moderate the tomorrow's program. So, sir, with your permission, sorry, first I will have to some brief introduction of all the eminent personality in the field of pharmacy. First, I would like to start with Dr. V. Gopal. Professor Dr. V. Gopal is a principal of College of the Pharmacy and Registrar Academic of Mother Teresa Postgraduate and Research Institute of Health Sciences. He has around more than 25-year experience in the field of pharmacy, and he is a member of various committee in the field of equine and many more. And we have one more guest, Dr. Yadav sir, Dr. A.V. Yadav sir. He is presently working as a principal at Gauri Shankar Educational and Charitable Trust, Gauri Shankar Institute of Pharmaceutical Education and Research, Satara, Maharashtra, India. You have already seen them in our catcher, or you can say the flyer. These members are syllabus committee constituted by the Pharmacy Council of India. We have one more member, very we have, it's a treasure of the pharmacy field, Shri Raj Ved ji. uh, Raj Ved ji, he's a basically community pharmacist. He runs the Hindu pharmacy in Goa. uh, इनके बारे में विशेष बात यह है कि फार्मेसी काउंसिल ऑफ इंडिया ने इनके अनुभवों को देखते हुए इन्हें आमंत्रित किया, और जिस तरह से ये काम कर रहे हैं बिल्कुल पूरे मनोभाव से, एक मेडिकल स्टोर से चालू किया, और किस तरह से एक प्रोफेशन के प्रति इनका स्नेह है और किस तरह से उन्होंने कार्य किया, तो उस इनके अनुभव को देखते हुए उन्होंने आमंत्रित किया, सिलेबस डिजाइन में इनको रखा। और सीधी सी बात है और साफ बात है कि सब इनके अनुभव से लाभान्वित हुए हैं। तो बहुत हमें गर्व हो रहा है कि हमारे बीच राजवैद्य सर हैं, और एक इसके साथ ही साथ हमारे दो बड़े विशेष गेस्ट और सब्जेक्ट एक्सपर्ट हैं, डॉक्टर, जिसमें पहला नाम लूंगा डॉक्टर नीरज उपन्यु सर, जो पूर्व में प्रोफेसर और डीन रहे हैं पीपुल्स कॉलेज ऑफ फार्मेसी भोपाल, और वर्तमान में ही इज रजिस्ट्रार इन द नेशनल इंस्टीट्यूट ऑफ फार्मास्यूटिकल एजुकेशन रिसर्च एंड एजुकेशन एंड देन हाजीपुर। एक साल पूर्व से उन्होंने यह कार्य संभाला है, और ये मेरे ख्याल से नाइपर के लिए भी बहुत बड़ी उपलब्धि होगी कि एक प्रशासनिक पद में ऐसे व्यक्ति ने अपना पदभार संभाला जो ऑलरेडी एक एकेडमिक्स में रह चुके हैं, रिसर्च में रह चुके हैं, काफ़ी बच्चों को उन्होंने सुपरवाइज किया है, पीसीआई में कई वर्षों तक अपनी सेवाएं देते रहे हैं, अलग अलग विभिन्न समितियों या जिसे हम कहते हैं कमिटी मेंबर्स रहे हैं, सिलेबस डिजाइन की बात हो या किसी भी तरह की, उसमें अपना योगदान दिया है, और एक लिंक का काम किया है कि नई जनरेशन और एक हमारी जो एक्सपीरियंस जनरेशन है उसके बीच में, और पीसीआई को बहुत फायदा हुआ इनके पिछले कार्यकाल के दौरान, ये सभी जानते हैं। और काफ़ी कम उम्र में ये एक नैक एसेसर भी हैं, और काफ़ी है बताने के लिए, लेकिन बस यही कह सकता हूँ कि ये हमारे बीच हैं, ये हमारे लिए सौभाग्य की बात है। और हमारे एक प्रमुख फार्मा लोग टीम के सदस्य जो एक सब्जेक्ट एक्सपर्ट हैं, जिन्होंने किताब लिखी है, और हमारे जो अतिथियों की तरह डॉक्टर सौरभ कोसे सर, ये कहने की बात नहीं, मैं सचमुच कह रहा हूँ कि ये बिल्कुल डायनेमिक यंग लीडर है, इंस्पिरेशन है बहुत सारे लोगों के लिए, और जिस तरह से वो कंटिन्यूअस एक इंटेलेक्चुअल और कंस्ट्रक्टिव फील्ड में अपना समय दे रहे हैं पिछले खासकर पिछले 3 से 4 वर्षों में, ये एक उत्साहवर्धन है सभी लोगों के लिए। और फार्मेसी प्रैक्टिस, जिसे लोग चॉइस आखिरी में रखते थे, जो होना तो प्रथम ही चाहिए, लेकिन इवन जब पढ़ाई के दौरान या पोस्ट ग्रेजुएशन के दौरान, तो इसके एक आईसीएफ कॉलेज मोगा में वर्तमान में कार्यरत हैं प्रोफेसर के रूप में, और डिपार्टमेंट के हेड हैं और हेड कर रहे हैं। तो ये एक छोटा सा ब्रीफ इंट्रोडक्शन, ये जरूरी था, आवश्यक है, ताकि हमारे दर्शक जाने। और पुनः आप लोग का सबका धन्यवाद, आपको धन्यवाद प्रेषित करते हुए अपनी ओर से डॉक्टर शेखर वर्मा मैं आपको धन्यवाद प्रेषित करता हूँ और वेलकम करता हूँ, और साथ ही साथ सारे फार्मा लोग की इंटायर टीम की ओर से। तो मुझे लगता है कि ये आप सबके लिए बड़ा रुचिकर होगा, क्योंकि ये एक नया इनिशिएटिव है कि वी हैव टू डिस्कस अबाउट द सब्जेक्ट in a public forum, open public domain forum. It is a really it will be definitely, it will be fruitful for the students, और ऑब्जेक्टिव यही है कि ये छात्रों के लिए हितकर हो। एक्चुअली इसको चर्चा करने का विषय यह है कि नहीं कि हम केवल सब उधेड़ बुन करें विषय केवल नहीं, हम हमारा प्रथम जो लक्ष्य है कि छात्र समझे कि इस विषय का महत्व क्या है, इसको पढ़ने से क्या फायदे हैं, और इसको सिलेबस में क्यों रखा गया है। और ये उनके लिए बहुत गौरव की बात होना चाहिए कि हमारे बीच ऐसे लोग उपस्थित हैं जिन्होंने इस सिलेबस को डिजाइन करने में अपनी प्रमुख भूमिका निभाई। दे डिड अ वेरी हार्ड वर्क टू डिजाइन अ सिलेबस, क्योंकि सिलेबस ये होता है कि 1 साल 2 साल की बात नहीं, ये आपके पूरे करियर के लिए इम्पैक्ट करता है, आपके इंटेलेक्चुअल लेवल को कैसे प्रभावित करता है। और जिस तरह से पेंडेमिक आउटब्रेक हुआ, कोविड पेंडेमिक आउटब्रेक 2019, तो ये सोशल फार्मेसी का महत्व देश में लोगों ने समझा है। तो इसी पे अब मैं ज़्यादा समय ना लेते हुए आपसे चर्चा प्रारंभ करूंगा, और प्रश्न प्रारंभ करूँ तो इसमें जो पैनलिस्ट है आप हमारे, तो मैं एक एक करके प्रश्न करूंगा। कुछ प्रश्न हमने छात्रों से मंगाए हैं, कुछ प्रश्न हमने अध्ययन करके ये निकाले हैं, और कोशिश होगी कि उसका एक आपसे एक सकारात्मक और जो भी है उत्तर एक समय सीमा मिले, ताकि हम इसको आगे बढ़ा सके। ओके, प्रोफेसर डॉक्टर वी गोपाल सर, I would like to start with you. During this pandemic time, we have seen a lot of, you can say, a lot of tragedies, and now Now people the people knows what is a pharmacy, and it is a very honor for us. It is very good sign for the pharmacy professionals. So just I would like to know how does this social pharmacy related to the public health?
Thank you very much for this nice question. At the outset, I would like to congratulate Pharmalog for this beautiful initiative, which is very much beneficial to the society. Number two, I would like to wish all the viewers a very happy pharmacy bill passing day. Today is the day on which the pharmacy bill was passed. So I wish you a very happy pharmacy bill passing day. And just like Dr. Shekhar Verma in his initial remarks had wished all the viewers a happy Vasant Panchami. Today, we need to evaluate two things. Today, I once again congratulate this Pharmalog for having starting this Gurukulam. Now, in a Gurukulam, you have a guru who is called as Acharya. In a college, you have a person who is called as the teacher. The root word for teacher is token. A teacher is a person who passes a token of his knowledge to his students. On the contrary, the root word for Acharya is chariot. What is the relationship between a chariot and a acharya? Chariot is the only vehicle that doesn't have a reverse gear. So acharya is a person who will be always moving on the front, and he will also ensure that his students and disciples are also moving on the front. Moving on the front means always we have to travel from unknown to known and from known to known. We should never travel from known to unknown and unknown to unknown. So this is the concept of a Gurukulam. And here I'm very happy that in the Pharmalog is coming out with a Gurukulam. Now the same concept of change. Change is the only thing in this world that doesn't change. So initially, if you take in 1960, we had a traditional pharmacy. That means we used to prepare medicine, give as far as possible. We used to go for natural sources. Then we had a scientific pharmacy. Scientific pharmacy where we were discovering new medicine. And then we had a pharmacy which was patient oriented. And now we have a pharmacy that is called pharmaceutical care. So to upgrade our pharmacists to provide pharmaceutical care to the public, we have this beautiful subject called social pharmacy. A few months back, we had an alumni meeting. And in that alumni meeting, I asked my students who are now out in the society in higher positions, I asked them, can you, each one of you, quote one incident that has made you extremely happy? One student who was my ex-student and now who is well placed, he just stood up and then he said, sir, I'm working as a pharmacist. We used to have Saturday afternoons as a diabetic clinic, and there used to be a lot of patients who come to the diabetic clinic, and they used to first go and meet the doctor. The doctor will take their prescription and then he will put one R. That means repeat whatever has been prescribed, the entire thing we will have to repeat. So they used to bring it to us, get the prescription refilled, and then they used to go back. But one day I observed one person who was very tired, who had a lot of loss of weight. I know him before. He was very lean and he was very tired. So I asked him, did you check your blood glucose level? He said, no, nobody checked my blood glucose level. Then I took him to the medical lab technician and he checked his blood glucose level and it was exorbitantly high. Then I had taken him to the doctor, and then the doctor said, I have already seen him. I have given a repeat prescription. I said, sir, repeat prescription will not work. Look at his blood glucose level. You didn't check his blood glucose level, but I had taken him and I have checked his blood glucose level. It is exorbitantly high. The doctor saw that and then he apologized. He said to the pharmacist, I'm very sorry. And then he had given a new prescription, and that patient afterwards has recovered, and whenever he sees the pharmacist, he raises both his hands and gives a pranam with a smile. So that made me happy. So this is the incident quoted by the first student. The second student, he gave another beautiful incident. Just in front of his medical shop, there was an accident. And what happened was there was immediately 108 ambulance was called. An ambulance came in, and in that ambulance there was only one person to carry the stretcher. but we need two people. So immediately the driver obliged. The driver was short, and the person who was lifting the stretcher was tall. So the tall person was catching hold of the leg portion of the stretcher, and the short person was catching hold of the head portion. And that fellow, who had already had some alcohol, he was started vomiting, and the position was head down. Then immediately the pharmacist came running out of the shop, and he said, no, this is not the way you should carry this patient. Now the tall person should catch the head, and the short one should catch the what you call leg side. Then say it's an emergency. What happened? Whoever catches where, what bothers you? He said. Then the pharmacist explained to him, no, it is not like that. If you don't do it, the vomiting he is taking will go back, and it will obstruct his what you call his pathway, airway. So that is create a problem. So please change your positions. And then they changed the position, and they saluted to the pharmacist. So the pharmacist was very happy with this incident. So like this, each and everyone started quoting one incident where they had been very useful to the society and the community, and all this put together forms the objective and scope of the social pharmacy, introduced for the first time in DPharm curriculum after a period of 30 years.
Okay, thank you, Dr. V. Gopal sir. Really, you explored very well about the objective and aim of the social pharmacy, and I think student can easily understand how this social pharmacy played the vital role in the public health. I have a syllabus in my hand. In the D Pharma first year, we have five theory subject and five practical subject in the social pharmacy. तो अब अगला जो मैं पैनलिस्ट के पास जानना चाहूँगा, क्योंकि प्रारंभिक जो रैशनल चीज़ें वी गोपाल सर ने बता दी हैं कि सोशल फार्मेसी का आधार क्या है, कि इसका ऑब्जेक्टिव क्या है, मैं अगले पैनलिस्ट रिस्पेक्टेड ए बी यादव सर के पास जाना चाहूँगा. हाँ सर, आपने अनम्यूट किया, बहुत बहुत धन्यवाद. मेरा प्रश्न ये है सर कि एक विषय और हम पढ़ते हैं, ये सोशल फार्मेसी तो नया जोड़ा, इसके अतिरिक्त एक विषय है ग्रेजुएशन में, प्रिवेंटिव फार्मेसी, ये सोशल एंड कम्युनिटी फार्मेसी. सॉरी, तो ये दोनों में प्रमुख अंतर क्या है, जो ये अंतर जानना था हमें.
Yes. At the outset, let me congratulate Pharmacy Council of India for coming out with such a nice syllabus for diploma course in pharmacy. In fact, PCI should have come out such a syllabus long back in 2000. But let it be. Now it is totally practice oriented, and the knowledge and skills the students will gain, that shall definitely uplift the professional status of pharmacy. Okay, now the community pharmacy is a retail pharmacy. It is a organization or a setup wherein the pharmacist stores and dispenses medicines as per the prescriptions written by the doctors, or when legally permitted, he may sell the non-prescription medications along with the information to be communicated to the patient. So it is that organization, or it is that setup which is working in a community for the goodness, for the benefit of community. So that is what community pharmacy. Whereas the social pharmacy, in fact, the social pharmacy has enhanced the scope of pharmacy profession. So far, we know that the pharmacists are concerned with dispensing of medications, along with it, dispensing of other healthcare products, along with it, provision of patient counseling. But now, with this social pharmacy, the preventive care, the pharmacist will be actively involved in provision of preventive care with the objective of attaining, maintaining, and improving the public health. So the scope of pharmacy profession has been increased. In modern world, especially in developed countries, this pharmacy the job of pharmacist or pharmacy practice is not limited only to dispensing of medications or the patient counseling, but it is also extended to preventive care for the attainment of uh, health of community at large, of public health. Hence, the difference is the social pharmacy enhances the scope of pharmacy profession. The community pharmacy, of course, the pharmacist, community pharmacists do take active role in provision of such preventive care. But so far, this social pharmacy subject was not included in the syllabus. Now it has been included. That is how it will enhance the scope of this pharmacy profession. So this is what the
Okay.
clear distinction between social pharmacy and community pharmacy.
Thank you, sir. Thank you very much.
Hello.
You really, yes, sir. You are audible, sir. And really, you're easily very nice way differentiate the difference, the social pharmacy and the community pharmacy. Community pharmacy related to the preventive measurement, and the social pharmacy the scope of the pharmacy. तो मैं दूसरे इसको और आसान शब्दों में जो छात्र हैं उनके लिए बताना चाहूंगा कि दोनों विषयों में अंतर है। आपका जो कम्युनिटी फार्मेसी है, सोशल फार्मेसी है, इम्पोर्टेंट दोनों हैं, प्रमुख दोनों हैं, लेकिन चूंकि आप पढ़ना चालू करेंगे जब, है ना, अब हमारे जो जितने गेस्ट हैं उनकी स्वयं की लिखी हुई किताब है, इसके अलावा और भी अतिरिक्त जो अच्छी किताबें पढ़ना चालू करेंगे तो आपको अंतर साफ पता चल जाएगा। और सोशल फार्मेसी में सबसे बहुत अच्छी बात है ये पब्लिक हेल्थ से रिलेटेड है, जैसे इन्होंने कहा। और अभी का जो एक वातावरण चल रहा है जिसे कहते हैं इन द प्रेजेंट सिनारियो, and we are facing a very disaster in a pandemic. We already seen since last 2.5 years we are getting the various type of the hazardous effect. तो उसमें क्या है कि किसका महत्व बढ़ गया है। इसलिए आपने सुना होगा या पढ़ा होगा समाचार पत्रों में कि एपिडेमियोलॉजी है ना, उसका महत्व बढ़ा है। तो एपिडेमियोलॉजी में जो जिनका रिक्रूटमेंट होता है, थोड़ा सा मैं आपके करियर पर्सपेक्टिव को ले जा रहा हूँ क्योंकि छात्र हित के लिए ये कार्यक्रम है। तो उसमें एक एपिडेमियोलॉजिस्ट तो होता ही है, आपकी भी जरूरत होती है जिन्होंने सोशल फार्मेसी का अध्ययन किया है, चाहे वो फार्मेसी के रूप में हो या एमएससी या दूसरे साइंस के रूप में हो। इसलिए इसका महत्व बहुत है और विशेष बात है कि इसको आप गंभीरता से और बिल्कुल ये मान के चलिए कि हमको कि अपने केवल अध्ययन के लिए नहीं है बल्कि एक सोशल अवेयरनेस, सोशल रिस्पॉन्सिबिलिटी के हिसाब से पढ़ना है। तो बहुत-बहुत धन्यवाद यादव सर, आपने बहुत अच्छे से अंतर को बताया और मुझे लगता है कि ये छात्रों के लिए हितकर होगा और ये जिस तरह से लाइव प्रोग्राम चल रहा है और आगे भी देखते रहेंगे और इसकी उपयोगिता बढ़ेगी और रुचि बढ़ेगी। इस हमारे जो फार्मा गुरुकुलम का एक ऑब्जेक्टिव ये भी था कि छात्रों में रुचि बढ़े, क्योंकि अभी ऑनलाइन मोड में सारी चीज़ें चल रही हैं, फिजिकल एक प्रेजेंस है नहीं उनकी कॉलेजों में। तो इस तरह से जब विषयों पर चर्चा की जाएगी तो उनको फायदा होगा। अब मैं ज़्यादा समय नहीं लेते हुए मैं राज्य वैद्य सर के पास जाना चाहूँगा। उनको हम सब सुनना चाहते हैं, फार्मा लोग के सभी सदस्य हैं, सुनना चाहते हैं और जिस तरह से उन्होंने एक प्रोफेशन की सेवा की है अपने अनुभव के। तो सर मैं बिल्कुल एक बिल्कुल प्रैक्टिकल प्रश्न करूँगा। आई वुड लाइक टू वेरी एक रैशनल क्वेश्चन। आपके मन में कैसे विचार आया कि एक फार्मास्यूटिकल स्टोर खोला जाए, उसको नियम कायदों से बिल्कुल चलाया जाए, क्योंकि अभी के बच्चे बहुत शॉर्ट टर्म में डिसीजन ले रहे हैं और तुरंत खोलने तुरंत प्रॉफिट देखना चाहते हैं। तो आपके सबसे पहले किस उम्र में विचार आया कि इस तरह के स्टोर ओपन करना चाहिए और इसमें किस तरह की बाधाएं रही, ये सब आपसे जानना चाहते हैं, जो आपको हिंदी या अंग्रेजी जिसमें आपको सहूलियत हो।
Yes, good evening and thank you very much for having me. It's a privilege to be with amongst all of the others. Actually, ये जो हम फार्मेसी, हिंदू फार्मेसी जो है वो हमारे दादाजी ने शुरू की थी. So it is more than 100 years old. So when I finished my graduation in 1989, I had different perspectives. And in addition to that, as I went on reading different things and looking at how the practice of pharmacy takes place in other countries, I was able to understand pharmacy practice better and I had a good opportunity to slowly start implementing that in my pharmacy. So it is not that I started the pharmacy, but from a product oriented pharmacy, that change I could bring. So slowly we started providing these patient care services. So we dedicated a separate area for patient care. In that, we slowly started doing height and weight checkups, doing body mass index, and then providing guidance and patient care, patient counseling to our patients. Then, whatever prescriptions and medicines are dispensed, we were able to provide information and step by step instructions and advice to the patients. And we also started blood pressure measurements in our pharmacy, blood sugar measurements. So during this pandemic, there has been a problem because of barriers, but otherwise, we used to see around 100 patients every day for either blood pressure or blood sugar checkup. So we are able to measure their pressure, monitor it, and also then in that short period available, we could provide them some basic tips and information and counseling. So anybody needed some extra information, we used to make them wait, or another pharmacist used to provide that information. So we have 6 pharmacists who are able to do all these services. And we also then introduced simple things like providing short and simple patient information leaflets to the patient, not too long, big letters, short and precise, so that people don't get bored reading it and looking at it only. So this sort of atmosphere we tried to create, and slowly the patients then come forward to us to ask our information, advice, and all these things to our pharmacist.
Oh, thank you, Rajveer sir. Uh, uh, we are receiving a question from a student also in WhatsApp number. I have one more question for you, Rajveer sir. What are the new things and concept added for students will know from this subject? Because you are one of the key member to design this syllabus.
So social pharmacy is related to social sciences. So what is happening around us is being adapted into pharmacy. So actually, every person who studies, who's lives on this planet should know what is happening around him, whether it's the environment, whether it are the social issues, whether it is poverty, that is the economic issues, what are the different health indicators, what is happening around them. So the students need to get a push into this. So actually, if you see a lot of students, if you ask them, they will say, we don't read newspapers." There are many who have interest in different things. So what is happening in the news? What is related to health? What is related to social aspects? So all of these things are affecting our health. So health is not looked at as an individual aspect. It is related to social issues, economic issues, environmental issues, and psychological issues, behavioral issues. So a person may not take a medicine for a full appropriate dose if he doesn't understand what it is, or if he does not have enough money to buy it, or he doesn't understand the importance of it, or there are barriers, language barriers, and literacy, health literacy. So there are so many aspects which slowly this subject has tried to introduce to the students. And it is not that see, unfortunately, diploma pharmacy is for 2 years. So it is not that the entire thing of social pharmacy can be introduced and the students can learn and become expert in that. But whatever basic we could introduce, and within the limit of 75 hours and practicals. So that is why we had this concept of assignments, so that those students who have additional interest can do additional assignments on their own besides that which is mandatory, then the field visits. So this would give a broader perspective to the students, and it is not only medicines and dispensing medicines. So social pharmacy is not only related to retail and community pharmacy, but it will help the pharmacist who is working in hospital, who is working in administration, who's working in public health. It gives a scope for the pharmacist to look elsewhere into public health, specialize in public health. Somebody wants to go further, B Pharm, M Pharm, and master in public health. So it tries to incorporate all these different aspects. So whether it is preventive medicine or doing simple things like preventive healthcare or even vaccination. And the thing is that some things are correlated. So whether subject of community pharmacy, hospital pharmacy, some things in pharmacology, something in pharmacotherapeutics. So we could not introduce everything in one subject. So some of the things which we thought were important were scattered a little in this subject, that subject. So finally, what is important is that the students goes through that, touching upon those different aspects. So whether it's not only in social pharmacy, which could not fit there, so but they could learn it in practical assignments in other subjects also in a correlated manner.
बहुत ही आसान शब्दों में बताया सर आपने, है ना। मैं छात्रों को बताना चाहूँगा कि सोशल फार्मेसी के बारे में जैसा राज्य वैद्य सर ने कहा, आपने आसानी से समझ भी लिया होगा। कुल मिला के इनकॉर्पोरेशन ऑफ वेरियस कंटेंट, वेरियस टॉपिक, वेरियस एस्पेक्ट इन द सोशल फार्मेसी। तो सबका सार है सोशल फार्मेसी। केवल इसको एक कम्युनिटी फार्मेसी के रूप में ना लिया जाए या रिटेल शॉप, ऐसा नहीं। You can achieve, or you can get the higher studies to get the various aspect of the career, for the knowledge, for the everything. So yeah, this one is our first cycle of the question with our eminent guest, special guest. We will continue it with the second or maybe the third round. अब मैं आना चाहूँगा नीरज, डॉक्टर नीरज उपन्यु सर के पास, कि इनसे प्रश्न बिल्कुल हम सभी तरह के पूछ सकते हैं, क्योंकि इनका लगभग 18 से 20 साल का अनुभव रहा है एकेडमिक्स में, रिसर्च में, और अभी अब रजिस्ट्रार बन के नाइपर जैसी संस्था में गए हैं। और व्यक्तिगत रूप से भी हम इन्हें जानते हैं कि इंटेलेक्चुअल हैं बिल्कुल। तो डॉक्टर नीरज, मैं ये जानना चाहूँगा कि जो सोशल फार्मेसी है, जो सोशल फार्मेसी किस तरह से जो नेशनल हेल्थ प्रोग्राम है भारत सरकार की या किसी भी प्रादेशिक सरकार की, वो उसे किस तरह से मदद मिलती सोशल फार्मेको को पढ़ने से? ये पहला प्रश्न है। इसका जवाब जब आपसे प्राप्त हो जाएगा, उसके बाद मैं इसके दूसरे पहलू पे जाऊंगा, प्लीज।
Thank you, Shekhar sir. First of all, very good evening and namaskar to all the eminent guests here. Gopal sir, Rajvedya sir, Yadav sir, Saurabh Kosi ji, सभी को नमस्कार. And happy Vasant Panchami to all of you. My greetings. And this question is very good because now, as I always discuss in different platforms, as well as in this Pharmalok platform also, that definitely, as we have seen the pandemic, this pandemic has shown that education has gone through different transition or transformation of education from offline mode to online mode. Just like that, if you talk about really this pharmacy profession, so for the last 15-20 years, it is also in the transformation phase. We are having so much of transformation. We, as a pharmacist, we also realize this. We also smell it. We also feel it, and we are really seeing, and we are lucky that we are the part of this transformation, and in different capacities we are contributing also. So uh, while seeing the transformation or transition phase of this pharmacy profession, this is very important that from the perspective of the as a pharmacist, the important contributor apart from the medical professionals, you are one of the key members in your national health mission. So it is very important when the Gopal sir or Rajvedya sir or Yadav sir were discussing about social and community pharmacy. It is very important for the students who are taking their degrees or diplomas in pharmacy. They have to understand, because you are one of the prominent person who have to play an important role, whether it is concerned with the community pharmacy, whether it is concerned with your research, whether it is concerned with any other aspect. one of the key aspect, if you talk about national health programs nowadays, you can really feel the change, because always we heard that in Europe or in different European countries or different other countries, Western countries, pharmacist is playing an important role as a vaccinator. He is providing the shots. So we have to understand the different role of a pharmacist. So if we really understand, and we if we really create such type of things, and we have to message out from our deeds, I always believe in that. We have to do such type of sensitization, that yes, pharmacist also has a different role to play, and we have to tell to the society. How we can tell? Not through our oral things. We have to really create awareness, as Rajved sir told, that he is doing this practicing of pharmacy for the last few years. So these are the real, examples where you can tell to the society, where you can have a very good message to the society. Yes, apart from the dispensing of pharmacy, there are different role of pharmacists. So these are the different roles in which this national health program, you have different roles, like you have demographic roles, family planning role, you have vaccination role. This COVID pandemic has really provided this vaccination is a key aspect. So in different roles, as a pharmacist, you have to do that, and society will definitely feel, yes, pharmacy is one of the key person or person who can really contribute a lot apart from the clinicians. They have a very good, correlation with and pharmacist, you can say, always we read, we study also, and we feel also that he is a ladder between the clinician and the general public or the patients. So that's how we can really contribute, and we can uh, we can let to the society, yes, pharmacy is a person who can really contribute a lot. So national, as far as national health mission is concerned, or national health program is concerned, there are a lot of roles to play, and this pandemic has provided really a great opportunity to all of us to prove ourselves.
Okay, thank you, Dr. Neeraj. Really, you elaborated very well how the social pharmacy related with the various national health program, not only in the country level, but we have already seen in the globally. Even WHO also conducted these type of program with the help of the social pharmacist. I have a syllabus of diploma in first year in my hand. There is a, in third unit, that is a nutrition and health. Actually, Dr. Neeraj Upanyu sir, in the rural areas of our different state, even on all the corners of the country, especially in the rural areas, and then especially the tribal areas, and then the forest areas, uh, uh, we are facing a problem of the malnutrition. When we see the survey and the data of the central government and the state, different state governments, we can see the problem of the malnutrition, not only in the female and the children's, but also in the normal male, and obviously in the elderly people. So how this social, my question is, okay, and I'm coming my question. My question is how social pharmacy student or social pharmacist or social pharmacy professionals, or this content of the syllabus, play the vital role to reduce the malnutrition problem.
इसके दो जवाब हैं। हिंदी हिंदी में दूं कि इंग्लिश में दूं, आप जैसा बोले।
नहीं सर, मैं चाहूंगा हिंदी में। क्या है कि देखिए,
हाँ, मैं समझ रहा हूँ, क्योंकि लोकल
हमारे
कोई क्वेश्चन आया, इसलिए मैं
जी
इसलिए
जी
आपसे पूछा।
दर्शक, नहीं नहीं,
देखिए,
दर्शक
गोपाल
दर्शक
सर, आई
हमारे,
टेक योर परमिशन टू गिव दिस आंसर इन हिंदी, बिकॉज मुझे लगता है किसी स्टूडेंट का क्वेश्चन है। देखिए,
जी जी
सबसे इंपॉर्टेंट चीज है, शेखर जी, बहुत अच्छा क्वेश्चन है। देखिए, सबसे इंपॉर्टेंट इसमें दो एस्पेक्ट है इस क्वेश्चन में। पहला एस्पेक्ट तो ये है कि अगर आप किसी पर्टिकुलर एरिया की बात कर रहे हो, अगर वो माल न्यूट्रिशन को या इस टाइप की प्रॉब्लम को एड्रेस कर रहा है, तो सबसे पहले उसका उस पर्टिकुलर एरिया से उस पर्टिकुलर एरिया से उसका जुड़ाव होना बहुत जरूरी है, क्योंकि उनकी भाषा में उनको समझाना पड़ेगा। जैसे आपने मुझसे प्रश्न किया, तो मैं समझ गया इसका आंसर मुझे शायद हिंदी में देना चाहिए। तो सबसे पहले तो ये रियलाइजेशन बहुत जरूरी है कि उस कॉन्टेक्स्ट तक उस बात को ले जाना है तो उनसे जुड़ाव बहुत जरूरी है। इसका दूसरा एस्पेक्ट ये है कि जब तक स्टूडेंट ने उस सोशल फार्मेसी को या कम्युनिटी फार्मेसी को अच्छे से नहीं समझा होगा, उसकी टेक्निकलिटी को अच्छे से नहीं समझा होगा, उसका रोल उसमें कहां पर है वो अच्छे से नहीं समझा होगा, तब तक वो उस एड्रेस को उस प्रॉब्लम को एड्रेस ही नहीं कर सकता। तो सबसे इंपॉर्टेंट चीज है, ये बिल्कुल सही है, माल न्यूट्रिशन है। अगर आप अपनी कम्युनिटी में ही देखो, हम बहुत सारी बातें करते हैं, हम कम्युनिटी में ही पाते हैं कि बहुत सारी महिलाएं हैं जो एनीमिक है, जो लड़कियां हैं या टीनेज हैं वो बहुत एनीमिक है, स्पेशली रूरल एरियाज की बात करें। लेकिन उनका ना तो कोई सर्वे अच्छे से आता है, ना उनकी प्रॉब्लम को एड्रेस किया जाता है। इसमें बहुत सारे एन नंबर ऑफ फैक्टर्स हैं, और उस जब तक उस प्रॉब्लम को एड्रेस नहीं किया जाएगा, जब तक वो खुल के नहीं आएंगी, तो उसमें एक संवाद का होना, एक कम्युनिकेशन का होना बहुत जरूरी है। तो कम्युनिकेशन एज वेल एज साउंड टेक्निकल नॉलेज, जब इन दोनों चीजों का ब्लेंडेड मोड ढंग से होगा तभी इस प्रॉब्लम को एड्रेस कर सकते हो। तो जैसा आपने बोला माल न्यूट्रिशन की प्रॉब्लम है, तो सबसे पहले आपके पास न्यूट्रिशन को समझने के लिए कि उस पर्टिकुलर एरिया की प्रॉब्लम क्या है। जैसे मैं एक छोटा सा एग्जांपल देता हूँ, यहाँ पे बिहार में, अभी मैं पटना में हूँ, तो पटना में गंगा किनारे क्षेत्र के एरिया का सबसे बड़ा एड्रेस प्रॉब्लम है। बहुत सारे लोगों से, साइंटिस्ट से, रिसर्चर से भी बात करा, फार्मासिस्ट से भी बात किया, सबसे ज्यादा जो प्रॉब्लम है कि यहाँ आसपास के एरिया में आर्सेनिक टॉक्सिसिटी बहुत ज्यादा है। आर्सेनिक हैवी मेटल है, और आर्सेनिक की एक पर्टिकुलर लिमिट से ज्यादा अगर वाटर में होगा वो, तो वो टॉक्सिसिटी प्रोड्यूस करेगा। मुझे जान के हैरानी हुई कि यहाँ के 5-6 एरिया है जो पूरी तरीके से कैंसर विलेजेस, जिनको नाम दे दिया गया है कैंसर प्रभावित गांव या कैंसर विलेजेस के नाम से जाने जा रहे हैं। जब इस पे स्टडी हो रही है, स्टडी चल रही है, तो भाई हाउ वी कैन, कैंसर, नेफ्रोटॉक्सिसिटी, ये सब बहुत ज्यादा बढ़ रहा है, गॉल ब्लैडर का कैंसर बहुत ज्यादा बढ़ रहा है। तो आई वाज सरप्राइज। तो इस टाइप के लोकल प्रॉब्लम्स को समझ के उसको एड्रेस करना, और कैसे साइंटिस्ट में काम कर सकते हैं, कैसे एक फार्मासिस्ट काम कर सकता है, तो इस टाइप की प्रॉब्लम को समझने के लिए दोनों चीजों का ब्लेंडेड मोड होना बहुत जरूरी है। जो पहला क्वेश्चन मैं आपका समझ पाया है ना। दूसरा, जब आप माल न्यूट्रिशन की जब आप बात करते हो, तो माल न्यूट्रिशन में भी सबसे पहले आपको इसके कंपोजिशन को समझना पड़ेगा कि भाई माइक्रो न्यूट्रिएंट्स क्या है, मैक्रो न्यूट्रिएंट्स क्या है, और उस पर्टिकुलर एरिया की प्रॉब्लम क्या है। जैसे मैंने आपको ये पटना का एग्जांपल बताया, गंगा किनारे क्षेत्र का, वैसे ही उस पर्टिकुलर एरिया में अगर माल न्यूट्रिशन हो रहा है, तो उस माल न्यूट्रिशन का सबसे पहले पॉजिटिव रीजन क्या है, उसका एटियोलॉजी क्या है। जब से बीमारी की एटियोलॉजी की बात करते हैं, तो उसके भी सबसे पहले आपने को कॉज जानना पड़ेगा कि वो माल न्यूट्रिशन किस वजह से हो रहा है। जब हम उस कॉज को मालूम पड़ेंगे, तब हम अपनी टेक्निकल नॉलेज एज वेल एज वहां की जो भौगोलिक कंडीशन होंगे, ज्योग्राफिकल कंडीशंस होंगे, उसके हिसाब से उस प्रॉब्लम को एड्रेस करेंगे। तो फार्मासिस्ट का भी बहुत
बिल्कुल सर,
इंपॉर्टेंट
बिल्कुल सर।
टेक्निकल रूप से साउंड होने से पहले आपको प्रॉब्लम को समझना अच्छे से पड़ेगा। दिस इज माय रिप्लाई व्हाट
बिल्कुल बिल्कुल, यही यही खास बात है इस विषय की, इस सब्जेक्ट की। इट कवर्स अ लॉट ऑफ एस्पेक्ट, नॉट ओनली द हेल्थ, बट जितने भी अभी जो चर्चा हो रही, डिस्कशन, दूसरे जो जब राउंड होगा प्रश्नों का, उसके फिर आएंगे आप सबके पास। अब मैं डॉक्टर सौरभ के पास जाना चाहूँगा कि जो प्रश्न आए थे, छात्रों से प्रश्न मंगाए हैं, कुछ जो फैकल्टीज जो टीचिंग करते हैं, क्योंकि आप सबने अच्छी किताबें लिखी हैं। डॉक्टर सौरभ जोशी सर की भी किताब है, बहुत अच्छी है, शानदार है, मैंने खुद उसको पढ़ी है। तो डॉक्टर सौरभ, आई हैव अ क्वेश्चंस ऑन बिहाफ ऑफ द स्टूडेंट्स, ऑल द स्टूडेंट्स, और मेरी तरफ से भी है ना, कि ये मैं पढ़ना चाहूंगा जो आया है। व्हाट आर द वेरियस सॉफ्टवेयर यूज्ड इन द फार्मेसी। पहला, चलिए पहला खत्म करते, फिर दूसरे पक्ष में आएंगे। इसके बारे में जो मॉडल फार्मेसी और जो वेरियस सॉफ्टवेयर यूज करते हैं, उसके बारे में आपसे जानना चाहेंगे।
Thank you, Sekar sir. It's a nice question, and first of all, I would like to congratulate PCI, Dr. Gopal sir, Rajveer sir, Upmanyu sir, because this syllabus came after 3 decades, and it is a wonderful syllabus as far as pharmacy practice is concerned. So, in first year, social pharmacy, in second year, community pharmacy management, therapeutics, and one another subject is there. So, total out of 11, 4 clinical subjects are there. सो एज फार एज डिप्लोमा इज कंसर्न, 2 साल का कोर्स है, 4 महीने की ट्रेनिंग होनी है डायडेक्टिक एक स्टूडेंट की। सो स्टूडेंट का एक मन होता है कि वो अपनी एक कम्युनिटी फार्मेसी स्टोर खोले, हॉस्पिटल खोले, जन औषधि केंद्र खोले, ऑनलाइन फार्मेसी खोले, या अभी टेलीमेडिसिन ई संजीवनी प्रोग्राम आ गया भारत सरकार का। तो जहां तक सॉफ्टवेयर की बात आती है, इन्वेंट्री या जो दवाइयाँ या जो सामान होता है दवाई की दुकान में, उसको समझने के लिए ये बात आती है कि सॉफ्टवेयर जो यूज करना है वो कौन सा है। यूजुअली हम लोगों के सिलेबस में या पाठ्यक्रम में, इन आवर सिलेबस इट इज जनरल दैट वी यूज टू टेल देम वेरियस ट्रेडिशनल मेथड्स such as ABC analysis, VED, EOQ, lead time, buffer stock, 2-bin method, etc. ABC एनालिसिस का सबसे पहले मैं बताता हूं कि यदि सॉफ्टवेयर नहीं है तो क्या करना चाहिए। ABC एनालिसिस का एक मैथमेटिकल एक्सप्रेशन होता है जिसमें कि एनुअल यूज कितना है दवाइयों का, एनुअल डिमांड कितना है, और उसका क्यूमुलेटिव निकालने के बाद दवाइयों को A, B, C कैटेगराइजेशन में हम लेके आते हैं। जहां तक फार्मेसी स्टोर की बात होती है, तो फार्मेसी स्टोर के अंदर जो सॉफ्टवेयर यूज में लाया जाता है उसका नाम होता है मार्ग ERP। ये सिर्फ दवाई की दुकान में ही नहीं बल्कि किसी व्यक्तिगत बिजनेस, कह लीजिए आप साड़ी का बिजनेस है, कपड़ों का बिजनेस है, एम्पोरियम स्टोर इज देयर, कोई आपका बिजनेस है, एट एनी प्लेस यू कैन डू। सो दिस मार्ग सॉफ्टवेयर जो इंडिया में सबसे ज्यादा यूज होता है, इट कॉस्ट अराउंड 25,000 फॉर फर्स्ट सब्सक्रिप्शन। एंड इसमें खास बात यह है कि इसके बाद इसके गोल्ड, सिल्वर एंड वेरियस अदर पैकेजेस आर देयर। और इस पैकेज की जो खास बात ये होती है, आप ऑनलाइन जैसे ई फार्मेसी का रिकॉर्ड रख सकते हैं। आजकल ऑनलाइन फार्मेसी चल रही है, एंड ड्यूरिंग कोविड पेंडेमिक वी हैव सीन दैट tremendously online door delivery of the medicines have increased. Previously, like 1 mg health card etc are available in the market. So there are advantages or disadvantages of e-pharmacy, but ऑनलाइन सॉफ्टवेयर में आप रिवर्स इन्वेंट्री रख सकते हैं। फॉर एन एग्जांपल, 50 पैरासीटामोल के स्ट्रिप है आपके पास, एक महीने में आपके पास 50 पैरासीटामोल के स्ट्रिप बिकते हैं। तो आज मान के चलिए कि 5 जनवरी है, 5 दिनों में फरवरी में आपने 5 स्ट्रिप बेच दिए, तो अब रिवर्स में आपके पास 45 बचे हुए। तो आपको एक अंदाजा लग जाता है, अनुमान लग जाता है कि आपके यहाँ दवाई की दुकान के अंदर रिवर्स में कौन सी दवाई में ज्यादा बिक्री हो रही है, खपत हो रही है, और उसके हिसाब से आप अगला रीऑर्डर एंट्री लेवल बनाते हैं। तो पहला मार्ग सॉफ्टवेयर है। फिर अकाउंटेंसी का टैली आता है, टैली का भी प्रयोग किया जाता है, बट उसमें थोड़ी अकाउंटेंसी स्किल्स की रिक्वायरमेंट भी होती है। चूंकि ड्यूरिंग मेडिकल स्टोर मैनेजमेंट ट्रेनिंग प्रोग्राम, आई यूज्ड टू रन वन मेडिकल स्टोर मैनेजमेंट ट्रेनिंग प्रोग्राम, 30 आवर्स कोर्स। सो इनटू इट दिस इज द कॉमन क्वेश्चन ऑफ अ स्टूडेंट कि जब हम लोग डिप्लोमा करके दवाई की दुकान खोलेंगे, फर्नीचर का खर्चा है, दवाइयों का खर्चा है, रैक का खर्चा है, रेंट एग्रीमेंट करना है, लाइसेंस लेना है, एसी है, इसके बाद में काउंटर बनवाना, देयर आर एन नंबर ऑफ थिंग्स एज पर स्केड्यूल है, उन्हें करना होता है। तो ये भी एक खर्चा आता है शुरू में। सो यदि सॉफ्टवेयर नहीं है तो वो सर मैथमेटिकल एक्सप्रेशन के थ्रू जा सकते हैं, अदरवाइज मार्ग सॉफ्टवेयर बहुतायत में भारतवर्ष में प्रयोग किया जाता है। माइक शेखर सर।
हाँ
यस सर।
है ना, सॉरी, है ना। बहुत बहुत धन्यवाद। आपने जो मार्ग सॉफ्टवेयर के बारे में बताया, क्योंकि डेफिनेटली स्टूडेंट्स के लिए बहुत ही फायदेमंद होगा, क्योंकि इसके बारे में ज़्यादा उन्हें जानकारी नहीं होती है। किताबों में हालांकि है। इसके बाद मैं आपसे ही जानना चाहूँगा डॉक्टर सौरभ, जो बाईलैंग्वेज बुक्स है ना, जो सोशल फार्मेसी में, ये किस तरह से मददगार रहेगी छात्रों के लिए?
बिल्कुल सर। जैसा कि अभी राजवैद्य सर बता रहे थे PIL के बारे में, पेशेंट इंफॉर्मेशन लीफलेट। सर ने कहा कि एक मरीज को समझने में दिक्कत होती है तो सिलेबल्स जिसे वर्ड्स कहते हैं और पिक्चर्स जिसे पिक्टोग्राम कहते हैं, इनका प्रयोग करते हुए आसान शब्दों में, एक रीजनल लैंग्वेज में कह लीजिए, क्योंकि भारत विविधताओं का देश है। द इंडिया इज कंट्री ऑफ डाइवर्सिटी, बायोडाइवर्सिटी, एंड द पर्सन who is able to understand in his or her language, that is good. Like आप बात करिए अर्बन, सब अर्बन या रूरल पॉपुलेशन की, मेट्रोपॉलिटन पॉपुलेशन की, तो वहां पर लोग अपने हेल्थ के प्रति ज्यादा सजग होते हैं। जैसे नीरज उपमन्यु सर अभी बता रहे थे कि यदि आप मान के चलिए कि आप बात करते हैं कि आपको बायलिंगुअल किताब यदि मार्केट में अवेलेबल होगी तो बच्चे को ध्यान में रखते हुए लिखी जा सकती है, और शायद 1-2 ऑथर्स ने उतारी भी है, जैसे डॉक्टर अमित चावला है एक यहाँ पे पंजाब में। सो बायलैंग्वेज का किस तरह से मैं बताता हूँ। AICTE भी एक फंक्शन कर रहा है जिसके अंदर इन्होंने ऑथर्स को प्रपोजल्स दिए हैं किताब को रीजनल लैंग्वेजेस में लिखने के लिए। बायलैंग्वेज किताब आने से क्या फायदा होगा बच्चों को, बहुतायत में जो हमारे फार्मेसी महाविद्यालय है और नॉर्थ रीजन में आप देखेंगे तो बच्चे किसी भी सब्जेक्ट को इजीली समझ पाए, ग्रैस्प कर पाए, इसमें ये किताबें काफी कारगर सिद्ध होती है। बिकॉज एट डिप्लोमा लेवल जस्ट +2 पास करने के बाद जब वो प्रवेश करते हैं तो शुरू में 6 महीना तो ओरिएंटेशन इंडक्शन में लगता है, और एक कॉलेज कल्चर में आने के बाद, अलग अलग जगह से आने के बाद में वो धीरे धीरे अपना बेस बनाते हैं। दैट इज वाई ईयरली पैटर्न है। और इन किताबों के साथ जो थर्ड चीज आती है, जैसे हमारे सिलेबस में बी फॉर्म एम फॉर्म में होता है कि थ्योरी, प्रैक्टिकल एंड ट्यूटोरियल, यहाँ एक तीसरी चीज आ जाती है थ्योरी, प्रैक्टिकल एंड फील्ड विजिट। एम आई राइट नीरज उपमन्यु सर? फील्ड विजिट जो है वो किस तरह से कारगर होगी हमारे क्षेत्र में। मान के चलिए कि सोशल फार्मेसी एक सब्जेक्ट है, इसमें इम्यूनाइजेशन है, फैमिली प्लानिंग टेक्निक है, यूनिवर्सल इम्यूनाइजेशन।
डॉक्टर सर सॉरी आपको मैं इंटरप्ट कर रहा हूँ, मैं इस पे आने ही वाला था फील्ड विजिट में। तो ये मेरे ख्याल से बहुत इंपॉर्टेंट है फील्ड विजिट सिलेबस, जैसा मैंने देखा कि जो, और इसको डिजाइन जब आपने किया होगा तो मेरा ऐसा परसेप्शन है कि काफी डिस्कशन हुआ होगा इस पे, क्योंकि बिल्कुल नया है और ये जेन्युइन कहना चाहिए प्रैक्टिकल चीज है कि आप थ्योरी के बाद कैसे जाते हैं। तो मैं आपसे बिल्कुल फील्ड विजिट के बारे में जानना चाहूंगा। ये प्रश्न आया भी है छात्रों की भी से और
बिल्कुल
अध्यापकों
सर,
भी से।
जैसे सर
इसके पश्चात इसी विषय में फिर इसके बाद आप डॉक्टर गोपाल सर से जानना चाहूंगा प्लीज
सर। जस्ट आई विल कंक्लूड सर। जैसे मास्टर डिग्रीज की यदि हम बात करते हैं एम फार्म की, तो वहाँ वार्ड राउंड पार्टिसिपेशन है, या फार्मडी में आप देखें वार्ड राउंड है, या आप MBBS फाइनल ईयर देखिए इंटर्नशिप है, वार्ड राउंड है, फार्मडी में है। यहाँ फील्ड विजिट उसी को इजीली बताया गया कि प्राइमरी हेल्थ सेंटर, प्राथमिक स्वास्थ्य केंद्र पर जाकर यदि बच्चा जाए और चार्ट बने होते हैं, वहां पर जो नर्सिंग स्टाफ, आशा स्टाफ, उषा स्टाफ होता है, उनसे एक इंटरेक्शन रखे तो वो ज्यादा समझ सकता है। थैंक यू।
थैंक यू डॉक्टर सौरभ। और आपने बहुत ही सरल शब्दों में बताया और छात्र देखेंगे तो बिल्कुल लाभान्वित होंगे। और इस फील्ड विजिट के बारे में एक और लास्ट में कंक्लूडिंग डिस्कशन हम करेंगे आखिरी में। नाउ प्रोफेसर डॉक्टर वी गोपाल, आई वुड लाइक टू रीड द सेम क्वेश्चन व्हिच वी हैव रिसीव्ड फ्रॉम द स्टूडेंट, दैट इज in a social pharmacy practical field visit of a student is proposed, which is very unique concept. Can we elaborate it? Or
Thank you very much. It is a very beautiful
have
question.
you heard my question, sir?
Yes, sir, I have heard it. Am I audible?
Okay. Yeah. You are audible,
Okay.
sir.
First and foremost, I congratulate the student who has raised this question. It is a very beautiful question. I remember we had a Teachers' Day celebration. In the Teachers' Day, usually there is a role reversal. That means we teachers, we sit as students and students take the role of the teachers. So one student was manning the class and I was sitting. Ours is a government college, so we have an engineer cell, and in the engineering cell we have one chief engineer, assistant engineer, and like that the cadre is there. The chief engineer was sitting with me. He is MTech civil engineer. Now the student asked a question to that civil engineer: sir, I will give you cement, I will give you sand, I will give you water, I will give you bricks, whatever required I will give you. Now as a MTech civil engineer, can you construct a wall 10 feet by 10 feet now? So this was a question raised by the student. The engineer stood up and said, please don't quote me, I have so far not touched cement. I don't know how to construct a wall, I confess. But if you construct a wall and give it to me, I can say whether it is of proper quality, whether the concrete is of the correct strength, whether the hardness is there, everything I can test and say. So theoretically I am very sound, but practically if you ask me to construct, I cannot construct. So this is the first issue. The second issue, I am very sorry to say this, I went for a PhD viva voce and it was in my subject of pharmacognosy. The candidate had done research on the bark of a tree. Now it is a beautiful work with publications in PubMed. She had around 5 publications, 5 presentations, excellent work. We all agreed, beautifully presented. We awarded her the degree, and as per the rule, we have to write the comments and we have to seal it and we have to submit it to the controller of examinations. We went to the controller of examinations, submitted it, and we were coming out. The candidate was waiting. Sir, please join us for lunch. Then out of curiosity, I just looked up and then I said to the candidate, see, what a coincidence. You are standing under the same tree on which you have done your research work, and you are inviting your guide and your external examiner for lunch. So when I said this, the candidate looked up the tree and said, sir, is this the tree? And then she called her mother and father and said, I will hug the tree. You take one selfie or you take one photo of the tree. I was taken back. I asked the student, have you not seen this tree? She said, no, I have not seen this tree. Then how did you do your PhD? Sir, we have suppliers. I used to say to them, I want the bark of this tree. So they used to bring and give me the bark. Did you not have an interest to go and at least see the tree? I have seen the tree in photographs. I have seen the tree in internet. But in reality, I have not seen. But the worst part is the tree is available in the same department on which you are working for PhD. So these both things had really shaken up the basics. That field visit is very, very important. We cannot be theoretical. We have to go to the field. And once we are in the field, then only we can understand social pharmacy. Without jumping into the water, we cannot learn swimming. So we have to take the student to the field. They should go to a garbage disposal area and they should see how garbage is segregated. They should go to a sewage plant and see how sewage is segregated. They should go to a model pharmacy like the pharmacy being conducted by Mr. Raj Vaidya sir and see how dispensing is being done. They should go to a beautiful hospital pharmacy and see how counseling is being done. They should go to a primary health center and see how the national health programs are being done. So unless and until you go and see in person, whatever you read in theory, it will be only theoretical. It will not be practical. So he will not be able to put it into practice. So that is why tutorials, assignment, and field visit, all these three have been introduced. And it is not only theoretical. After the field visit, you have to give a report. And how to evaluate that report, that also has been given in this ER 2020. So it is not it's not superfluous. So they will have to go for a field visit, they'll have to write a report, and even guidelines of how to evaluate that report has been given. So once they go in, so now being in a classroom, sitting for 6 hours in a classroom and learning, that is one part. But when you say to the student, I'm going to take you to the field, he will become very happy. So it is a learning with nature, learning along with nature, learning with the general public. So that was the reason why this field visit was introduced. And I am sure it will be a mega hit. The students will love it. The teachers will love it. The community will be benefited out of it. And our profession will grow to great heights because of this field visit. Thank you for this excellent question.
Sir, may I interrupt, Shekhar sir, if you permit me?
Yes, sir. Please, sir.
Add one thing. Just Gopal sir has told. We actually, we went to our institute with some teachers. So I was discussing. So teachers among them were discussing. So they have to take 2-3 postdoctoral students for their research work. So one teacher was saying to another teacher, do it very fast. Otherwise, next lot is coming, which is totally online. They don't know the practical work, so they will not be helpful in your research. So whatever you want to take a student, take very fast. Otherwise, online student is coming. So, sir, you are very correct. They were very afraid. They all are PIs of their respective research work. And they were saying, do it fast because next lot is coming now. We are not able to get the students.
Corona
So,
batch.
yes, practical work is very important. Agreed, sir. Agreed, sir.
Thank you.
Then thank you very much, sir. Am I audible?
Yeah, you are audible.
Okay. Thank you very much, Professor Gopal. Really, you have given a very good example of a field visit with the story of bark. And personally, I believe pharmacy is the practical subject. Even in the theory, there is a practical. We are related to the vital field. Our manufactured or prepared product
चालू आहे पण ते ऐकायला तिकडूनच येत नाही. नाही पण
सर ऐकू येतं
हॅलो.
पण डॉक्टर शेखर त्यांची लिंक गेली आहे. तुम्ही दिसता सगळ्यांना, तुमचं ऐकू येतं.
Sorry, there is some network issue, I think, from my side. Now, am I
Yes.
audible?
Yeah, you are audible.
Okay. Thank you, Professor Gopal, for your nice light story about the bark. Now, I would like to go for Raj Ved sir. I have a questions and one doubt also. Actually, this question related to the about the career of the students. Sir, can you elaborate what are the various career opportunities in social pharmacy for the students?
Yes. So the social pharmacy, as we have been talking, gives a different perspective to the students so that they can think broader, that it is not just retail pharmacy and not just hospital pharmacy. So within these two also, they can broaden their perspective. So it is not only dispensing of medicines. So as some incidences have been narrated, an accident happened outside. So first aid, not only in the community but also within the pharmacy, and providing so many point of care services like blood sugar, blood pressure measurements, or any other aspects. And besides that, if the student has further interest, then he can go further into deeper into social pharmacy aspects, into public health aspects. Of course, for that you need a graduation, so you can do masters in uh, public health or in. So far we don't have as such a social and administrative masters in pharmacy in our country. Maybe hopefully it will soon happen. So this gives a different perspective to the students. As students of diploma in pharmacy, they can look into providing better services in their community pharmacy or in the hospital pharmacy. But once they upgrade themselves to degree or further than that, then this forms the basis of giving a wider perspective so that they can look into different aspects of public health. And so thus social pharmacy can give them a foundation to look in a much broader way. And as sir has said, the actual practical aspects are very important, field visits, practical aspects, so that you can actually do it yourself. So whether it's in the community or whether it's when you are traveling somewhere or at the site, whether it's first aid or doing a CPR, all these things are very important as a member of society. Now, being a pharmacist gives that additional value and basic background for that.
Okay, thank you, sir. We have one more terminology very commonly used in the pharmacy, that is the pharmacovigilance. Uh, how, sir, community pharmacists play the vital role for the pharmacovigilance to know the various types of the interaction and the side effect of the drug. Uh,
Community pharmacies is the point where the patient keeps coming back. So if the patient is reporting any side effects, then the pharmacist is in a good position to understand whether these side effects are expected part of the drug or it is something which is rare. or whether the patient should take the side effect uh, not so seriously because it is not so serious, it's a mild effect and it's an expected effect, or whether he should be alert to certain things. So even by dispensing certain alert measures or providing information to the patient can help. And also, if the pharmacist can then inform the patient that if you notice any side effects, please do report to me. So it's not that to every patient, but as a general, the pharmacovigilance program of the country is has asked the doctors, nurses, even the patients, that is the public, to report directly to the pharmacovigilance center. Even online reporting is there. So pharmacists, if they proactively take part into this, because pharmacists are facing patients from regularly. So if any side effect is there, generally the doctors tells them to stop taking this medication, return it, or the patient come directly to the pharmacist saying that this has given me side effect, what I should do. The pharmacist can pull up all these information and be a good point for reporting to the pharmacovigilance center, whether it's a vigilance center within the city, within the state, or now there is option of reporting online also. So that basic information and inputs and training on pharmacovigilance to the pharmacy student can help in a great way in building up that atmosphere of pharmacovigilance.
Yes, sir. Yeah, truly agreed. You very well explained how this community pharmacy related to the pharmacovigilance. Uh, we have one more question on behalf of the this Pharmalog team received from the student. I would like to ask this question to Dr. Saurabh. We have one term in our syllabus, that is a pharmacoeconomics. Okay, if this contains the suffix economics, so definitely the question arises: what is the importance of pharma economics in the country?
Yeah, definitely, sir. It's a nice question. Pharmacoeconomics and epidemiology, both pharmacoepidemiology and economics. Suppose we have 140 crore population in India, and as per census count, we segregate the peoples in below poverty line, medium, and above. So median per person capita and the cost of the medicines, these are the two factors. Let us take one example in diabetes. We have a very wonderful molecule, dipeptyl peptidase 4 inhibitors, GLP-1 agonist. It is a very promising molecule. It got approved in 2012 May. Very wonderful molecule. It reduces obesity. It gives wonderful effect in a month. But the cost is, for 10 vials, it costs 25,000. So for a normal person in a chronic state of diabetes, it is not possible to carry this cost and cost over. So the molecule have a MRP, its formula is there. And second thing, in our India itself, we have drug price control order. In COVID pandemic, the essential medicines, certainly the cost went high. So example of hydroxychloroquine. And certainly it has to come under H1, as Dr. Atul Nasa said in one conference. So in pharmacoeconomics, first we see pharmacoepidemiology as per the disease burden, either it is incidence, prevalence, morbidity, mortality rate, मृत्यु दर कितनी है, जन्म दर कितनी है, कितने लोग उससे ठीक हो रहे हैं, और किस क्षेत्रों में कितनी है. So integrated disease surveillance program, which we get the information. So pharmacoeconomics is something which, as per the disease state, there are long-term illnesses like asthma, tuberculosis, where patient has to take medicines for long time. 30 दिन की दवाइयाँ लेते हैं, फिर रिफिल करवाने आते हैं. Pharmacoeconomics is something concerned on their direct pocket cost. So direct cost and indirect cost. Indirect cost मतलब जैसे मान के चलिए कि किसी को डॉक्टर को दिखाने जाना है, रेगुलर चेकअप पे, रिविजिट पे, उस दिन उसे छुट्टी लेनी पड़ेगी, ट्रैवल का कॉस्ट है. ट्रैवल का कॉस्ट होने के बाद में वो कहीं जॉब कर रहा है तो उस दिन की उसकी सैलरी. So the factors relating indirect and direct cost onto the therapy, and that should be in the limit. So that is why जब हम पेशेंट की हिस्ट्री लेते हैं तो उसमें एक कॉलम होता है सोशियो इकोनॉमिक स्टेटस और ऑक्यूपेशन. तो ड्रग प्रिस्क्राइबिंग इंडिकेटर्स, एंड एज फार एज इंडिया की बात करें तो इंडिया में दैट इज वाई देयर इज अ कॉन्सेप्ट ऑफ जेनरिक मेडिसिन, जन औषधि केंद्र, where the medicine brought in very economic order, and this is really helpful also. So during pandemic itself, in the Moga Punjab, when other retailers here in Moga Punjab, they did strike because deputy commissioner told that you have to do the doorstep delivery of the medicine. So suddenly they gave us from Jan Aushadhi Kendra 10 lakh rupees medicines to our college, and they said from the deputy commissioner office you will get the prescriptions, say 25 or 30 prescriptions, and that are general medicines, sir, like over the counter or some medicines. And then we used to pack it, and certainly the district commissioner vehicle will come in the evening, they will take that packets and will distribute to the home. So pharmacoeconomics specifically is directly related to the cost, and there are scientific models like cost minimization analysis, cost benefit analysis. It is in M-Pharm pharmacy practice a subject, as it is in PharmD, and now it is introduced in diploma level. So definitely this is going to benefit them in a proper manner. At basic root cause level, it will definitely help them. It is the 6th unit of social pharmacy book, and which is authored by me, and Neeraj sir is also one of the author in this book. So definitely at the diploma level, at primary level, it will be introduction, and there are n number of examples.
Yes.
Definitely, Rajvedya sir can tell more examples in general related to pharmacoeconomics.
Yeah. Thank you, Doctor Sir. You are really and nicely elaborated about the term of pharmacoeconomics, because it is a new term for the diploma student, because they just crossed the higher secondary examination in 17 to 18 years. And most of the people, most of the students are familiar with the pharmacovigilance, but you expert included these term in the social pharmacy syllabus in diploma level. It is a very nice initiative. Now I would like to go to Dr. A.V. Yadav sir. Sir, am I audible?
Yes, sir, you are very audible.
Yadav sir. Yeah. Sir, Yadav sir, my question is, what are the various scope and learning objectives of social pharmacy as far as the diploma concerned? I think some network issues there.
Hello, sir.
Professor Gopal? Okay, now Yadav sir will come. Yadav sir, shall I repeat the question?
Yes, hello.
Yeah. You are audible,
Hello,
sir.
sir.
Shall I repeat the question? Shall I repeat the question, sir, for you?
Yes, repeat the question.
Yeah, my question is, sir, what are the various scopes and learning objectives of social pharmacy as far as D-Pharm is concerned? Basically, this question
Can you
related
please
to
repeat, sir?
actually, the question is, sir, what are the various scope and learning objectives of social pharmacy?
Yes. Basically, social pharmacy is concerned with public health, and hence related with total basic knowledge, fundamental knowledge of public health, preventive measures, then other social health related concepts, and emphasis is to be given on what is the role of pharmacist in provision of public health. So this is the scope, and the objectives are public health and national, the detailed study of public health, national health programs, preventive health care, food and nutrition related health care,
Shekhar sir, if you allow me, in the meantime, sir will join.
Sure, sir. If you give answer, it will be good, sir. Please, sir.
Okay, sir. So as far as social pharmacy subject is concerned, sir, this social pharmacy basically it is designed to impart the knowledge in public health, epidemiology, preventive care, and the health-related quality of life. So that the role of pharmacists in public health programs, national health program must be increased, and its outcome will be like various national health program like Rashtriya Bal Swasth Kalyan, or you say RNTCP, or you say National AIDS Control Program, or various WHO program like Universal Immunization Program, worldwide it is used. So we have National Immunization Program, and various public and private health systems who work voluntarily, as well as we take the examples of some international goals like Sustainable Development Goals, Millennium Development Goals, preventive healthcare, pharmacoeconomics. So basically, the general roles and responsibility of pharmacists in the public health, nutritional status, fruits, foods, or the hygienic conditions, sanitation, general health, family planning, water, usable water, drinkable water, what is the role of municipal corporation, and various hazards and preventive healthcare things has to be come up in this social pharmacy subject specifically. So it is as simple as diploma students have a lot of good energy, and when they go into the various primary health centers in the rural population, if they go suburban area in the civil hospitals, so various setups, either private hospitals, say some government hospitals, some NABH accredited hospitals where they will come to know NABH quality standards and the practices. Like one of the thing is the disposable of regulated and unregulated waste. So practically, what are the various problems comes in the part of practicing the health in hospital, in home, in social domains, in publics? This course or this subject is specifically designed. When we talk about overseas, there is one subject called as social and administrative pharmacy, what Rajvedis ji was talking about. So social and administrative part deals with the our public health as well as the lawmakers, नीति निर्माताओं का जो इसमें एक महत्वपूर्ण योगदान होता है. So these are the various scopes and learning outcomes and the course outcomes of this specific subject theoretically.
Okay, thank you, Dr. Saurabh. You explained about the course outcome and what is the course objective. And I think these outcomes is very fruitful for the not only for the student but for the college also, because nowadays all the accreditation body like NAC and NBS working based on the outcome based result. Okay, what you have done, you have to produce the result, and in the beginning of the syllabus you given the scope, course objective, and the course outcome. Now I would like to ask questions to Dr. AK Yadav sir. Sir, if we suggest to the government, either state government or central government, as for the concern of the social pharmacist, if government give opportunity to us, you suggest the 2 points for the betterment of the pharmacy profession and the betterment for the healthcare system. What two suggestion would you like to give to the government?
the knowledge and skill base of the pharmacist, especially those who will come out from this year 2020, they will have adequate knowledge. As practical component is more, they also will have required skills and the attitudinal change which they will receive, which will be inculcated into the students through practicals, through field visits, and the tutorials. All this will form a basis of adequacy, or all this will form a basis of competence. So on the basis of this competence, the government should, in fact, I have learned, or what is learned is that in national health policy, there is not mention of pharmacist. Pharmacist, the services of pharmacists have not been mentioned. So at least in national health policy, there should be inclusion of pharmacy services. That is based on the competency of the pharmacist, the knowledge and competency. So inclusion in healthcare policy, and the organization, the associations, IPA, Indian Pharmaceutical Association, or APTI, all the organizations should take this issue to the government and should convince the government to include pharmacist as the important member of healthcare team, healthcare provider.
Yeah, you have given a very right suggestion for the government. Definitely, it should be, and we are uh, very highly and motivated connecting link between the physician surgeon and the common people. The government should know what are our roles and how we can play the important and vital role for the society, for the patient. We have already seen during this pandemic outbreak the lacking of the human resource for the serving the patient, for serving the society. And this time we had to explore ourselves, and almost I tried to ask the questions received from the few faculty members and the students, but we have a few points to discuss. मैं उस पे आना चाहूँगा. मैं आप ये प्रश्न सभी से है ना, आप एक एक करके जवाब दे सकते हैं. प्रोफेसर गोपाल अभी जुड़ जाएंगे. यह जो सोशल फार्मेसी है, इस सब्जेक्ट को फार्मेसी करिकुलम में या फार्मेसी पाठ्यक्रम में ही रहना जरूरी है, या इसको इसके अतिरिक्त अन्य विषयों के साथ भी जोड़ना जरूरी होगा वर्तमान परिस्थितियों, या जिसको हम कहते हैं सर इन प्रेजेंट सिनेरियो? जरूरी है क्या कि हम केवल फार्मेसी वाले ही इसे पढ़ें? इसे दूसरे खासकर जो विज्ञान के, साइंस के विषय उसमें रखा जा सकता है क्या? मैं I would like to first very short your opinion.
सर मैं
हाँ प्लीज नीरज सर प्लीज.
शेखर सर, मैं इसमें थोड़ा सा बोलना चाहूंगा. बिल्कुल रखा जा सकता है. अगर आप नेशनल एजुकेशन पॉलिसी को देखें और उसके ड्राफ्ट रेगुलेशन को देखें, और अभी भी नया एक ड्राफ्ट रेगुलेशन, तो बड़ी इंपॉर्टेंट चीजें उन पॉइंट्स में रखी गई हैं कि प्रोफेशनल नॉलेज, प्रोफेशनल स्किल, कोर स्किल. तो अगर इन पॉइंट्स को बहुत क्लोजली कंसीडर करो तो डेफिनेटली ये सारे सोशल फार्मेसी को अगर किसी इंपॉर्टेंट सब्जेक्ट के रूप में रखना है, जैसे फर्स्ट एड की बात करते हैं, तो फर्स्ट एड पढ़ाया जाता है. फर्स्ट एड केवल फार्मेसी में नहीं पढ़ाया जाता, फर्स्ट एड केवल नर्सिंग में नहीं पढ़ाया जाता, फर्स्ट एड केवल पैरामेडिकल में, फर्स्ट एड केवल मेडिकल में नहीं पढ़ाया जाता. तो इसी तरीके से एक नॉर्मल फार्मेसी को लेना है, नॉलेज, प्रोफेशनल स्किल, कोर स्किल, रेस्पॉन्सिबिलिटी, अगर इन पॉइंट्स डेफिनेटली यू कैन टेक इट.
बिल्कुल प्रोफेसर गोपाल,
हमारे विजन, हमारे ब्रॉड में, अगर हमारी फार्मेसी को ब्रॉड एस्पेक्ट में अगर सोसाइटी को एनलाइटन करना है, उनकी सोसाइटी को विजन में लाना है, सोसाइटी की पिक्चर में आना है फार्मेसी को, तो ये सब बहुत जरूरी है.
बिल्कुल अग्रीड. प्रोफेसर डॉक्टर वी गोपाल, should this social pharmacy included in the other stream apart from the pharmacy, like science or any arts or humanities?
Like if it is incorporated in allied health sciences, like for example on all the nursing courses, like for example ANM, DGNM, BSc nursing, MSc nursing, or in BPT, or in BSc MLT, or MRIT. So it will be beneficial. So they will be having an outlook. Overall, we have to see the benefit to the society. So the society will be benefited. So a system will be in place. And but we cannot say no, they have their own specializations. So each and every course is tightly packed. But in the best interest of the society and our health system, if it is incorporated in other allied health sciences also, it will be beneficial. Very importantly, it should take a part in Ayurveda, in Siddha, and in homeopathy, and in Indian systems of medicine courses. So an Ayurvedic doctor, an Ayurvedic pharmacist, his knowledge on social pharmacy will be very much beneficial. Similarly, a Siddha pharmacist, similarly a homeopathy pharmacist, a Unani pharmacist, he should have a very good knowledge on this social pharmacy.
Thank you, sir. Thank you, sir. Thank you. Rajvet, sir, the different question. How we can create interest about the social pharmacy to the student, towards the student? How we can create more interest about the subject?
The different aspects are built into that so that that interest is developed. But ultimately, it's up to the faculty members how they can generate that interest. The way of teaching, the way of presentation,
Yes, yes, yes.
not fully spoon feeding, at the same time getting good interactions. That is why these field visits, assignments are important, and practical work is also very important. So theory and practical and field visits, all these, if these are correlated and giving actual practical examples, making the students live with what is going on around them, all these things will generate that interest in the students.
बिल्कुल बिल्कुल अग्रीड टोटली अग्रीड सर बार बार वही बात आ रही कि फील्ड विजिट ना एज आई सेड आई पर्सनली बिलीव इट इज द प्रैक्टिकल सब्जेक्ट फार्मेसी इज अ प्रोफेशन that is even a theory subject contains the experiment and practicals, the various principles, mechanism, and all the physics, chemistry, biology, all science comes together in the pharmacy. That's why pharmacy is so important. Dr. Saurabh, आपसे ये जानना चाहूंगा कि छात्र जो हैं, जो स्टूडेंट्स हैं, जनरली हर विषय को एक परीक्षा की दृष्टि से अगर देखते हैं तो वो क्या पढ़ते हैं, पढ़ के पास हो जाते हैं। वो उनके लिए करियर के लिए ज़्यादा उपयोगी नहीं रहता है। तो अगर 2 साल, 4 साल, 5 साल बाद कुछ अगर अमेंडमेंट करने की गुंजाइश होती है सिलेबस में, एक हाइपोथेटिकल प्रश्न है ना? एक बच्चों की जिज्ञासा है ना, ये बच्चों की तरफ से आया है कि सर इसमें कुछ और होना चाहिए। इस 5 यूनिट के अतिरिक्त और कुछ होना चाहिए। अच्छा, चूंकि वो स्टूडेंट छठवां नहीं चाह रहे हैं, वो चाह रहे हैं रिप्लेस कर दें एक को, है ना? वो 6 यूनिट नहीं चाहते हैं, दे वांट टू जस्ट रिप्लेस, ओनली 5 यूनिट शुड बी रिमेन। तो 2 साल, 4 साल, 5 साल बाद कुछ अमेंडमेंट होता है, तो आप कौन सा टॉपिक इसमें इंक्लूड करना चाहेंगे?
Definitely, sir. This is the work of our Professor Emeritus and the working pharmacists like we have in the panel right now. Like Rajvet
नहीं
sir
नहीं
is
बिल्कुल,
there.
मैं थोड़ा इंटरप्ट करूंगा। बिल्कुल आप सही हैं, लेकिन क्या है
What
कि इन्होंने अपना काम कर दिया, दैट इज वेरी गुड। दे आर वेरी ट्रूली डिजाइंड वेरी वेल, बेस्ट सिलेबस फॉर स्टूडेंट। आपकी जनरेशन के लिए मैंने पूछा, आपकी जनरेशन और बाकी में बहुत अंतर, आप बताइए प्लीज।
there is a saying in English, sir. Experience is the only teacher. So once I would say, sir, we wrote in social pharmacy in pages, in books, and sir see Rajvedya sir see pharmacy in real, and at
रियल
administrative part Upmanyu sir, Gopal sir, as well as Rajvedya sir is seeing, and Ayan Yadav sir is an author. So there is one thing very good we missed in today's discussion is the model pharmacy.
यस
Uh,
यस यस
Meanwhile, Rajvedya sir pharmacy is considered as model pharmacy of India in globe. When we talk about this model pharmacy, when we want to teach our students as pharmacy store in our department level, So let us have a model like a science exhibition. We prepare a model with thermocol sheet and all the things. So let us prepare a model pharmacy. Let us have a old refrigerator from a storeroom of which is dump. Let us have an old air conditioner, have a counter, have a registered pharmacist certificate. Let us paste the vaccine storage or various medicine storage condition onto the door of the refrigerator. A standiometer, height measurement scale, a weight, or say drop, this ear drop, eye drop demonstration, or say a nebulizer unit over there, that what I have in my department, and demonstration. So this is number one, sir, in-house, along with the theory practical part. Theoretically, from exam point of view, obviously assignments are helpful. You are talking, sir, about vision 2030 after say couple of years, 3 years, 5 years, 10 years, near
Yes, yes.
2025 or 30. What are the various changes? So, sir, science is ever changing. We saw glycated hemoglobin, HbA1c. When I did masters in pharmacy practice, it was 6.5 in 2012. Now it is 7.5 as per International Diabetes Federation. So, as per the requirement of the society of the Asian population, specifically India, whatever the new things comes, every year we have a new virus, sir. 2017 Ebola, then 2018 Zika virus, 2019 H2N3, 2019 again we had COVID. As per the things requirement, you will be glad to know that in social and preventive pharmacy, B Pharm 8 semester, in second unit 2.4 is our this SARS COVID. So at B Pharm level, it is included very recently. In 2016, we had the syllabus of B Pharm regulations. So whatever the new things are coming up after the visiting to various countries, various discussions, cost-able discussions, these things will come out. Various stakeholders, definitely teachers, students, uh, as well as the pharmacy divisions. If I would say telemedicine is also included in second year diploma syllabus, community pharmacy management, where we have e-Sanjeevani program of Government of India. So this syllabus is very much, I think there is no need for coming 1 or 2 decades to change this syllabus. What I felt, I have read one word of this syllabus, 81 pages I have printed out, being as a pharmacy practice faculty. So what I want to tell is, sir, this syllabus is made up with very good sound techniques, not only first aid, Dr.
Yeah,
Upanyu
I
was
have in
telling,
my hand. Just looking.
emergency medical technician, if I say basic life support. I did, sir, BLS and ACLS from American Heart Association, ITC International Training Center here in Punjab. So this syllabus provide the information of NDRF also, emergency pharmacist disaster management.
Yes,
This
yes,
syllabus
yes,
provide
yes.
information about emergency medical technician, a person working as a EMT on 108 ambulance activation of emergency medical services. So if a student goes in very detail, but the thing is that lack of availability of the trained and skilled staff who can translate this syllabus very adequately to the students. This is the one point, and I think Professor Gopal
Yeah,
will agree with this point with me.
Yeah, yeah,
Yes, yes.
I agree.
So definitely the
I do
things
agree.
will change, and the outputs and the
yeah,
inputs.
yeah. Professor Gopal, you can, if
So
you want to
far,
continue, yes, you can.
yes,
Yeah,
yes. So far,
Doctor.
as per year 2020 is concerned, the content is very nice. Content, but the and we are good in delivering content. But the intention behind teaching these subjects, this intention is to be delivered. And this delivery
Yes,
of
yes.
intention, with that intention, the content is to be delivered, and this is the job of teachers. The
Yeah,
responsibility
yeah.
of teachers have grown to a great extent, and teachers need to take this positively, and the intention is to be delivered. That is needed.
Definitely, definitely, sir. It is a duty of the all the academician to properly and honestly deliver the well-designed syllabus to the student. Yeah, Professor Gopal, you want to say something?
Yeah. See, teaching in some places, the teachers act as photocopiers and as tape recorders. So that thing will have to now go with this new syllabus that
Yes.
can never exist. And the teaching is not filling the bucket, it is lighting a fire. So as per this new syllabus, they will have to inspire the student to become an 8-star pharmacist. So these are the two things. And the third thing is, as I said, a teacher is an what you call an abbreviation of teach, each, he, and her. So each and every student will have to be given equal importance in making him involved in the subject and making him self learn and helping him to guide himself to come up as a professional ideal pharmacist. So the subject itself is such that the teacher will be a lifelong learner, and he will learn throughout and update his knowledge, and at the same time he will be inspiring the student to become an ideal pharmacist.
Truly, truly right, sir. Okay, Rajvet sir.
Yes, I just wanted to add that teacher should have the practical experience so that he can teach. So if whether it's a visit to any of the field visits or the
Again, it is
assignment or the
about the
practicals.
field visit. Yes.
No, whether it is the practical. So as Dr.
Yes,
Saurav
yes,
has
yes.
said, CPR techniques, or whether it is actually working or observing in a community pharmacy, working in a PHC as an observer or in that capacity. So more experience or more exposure they have in all these fields which are related, they can teach better. So only when you are at the counter of a community pharmacy or working in a hospital pharmacy, you will understand the real problems, social
Yes,
problems,
yes, yes.
economical problems. So that is a prerequisite. I feel the teachers should be pushed into the water so that they also learn to swim better.
Yes, yes, I completely agree, sir. That's why I already told that it's a duty of all the academician and teachers. They have to deliver properly and honestly. I focus the term honestly because the you did very hard work. Definitely, if you see the content of the syllabus, it looks very good. It looks very good. It contains your nutritional part, epidemiologist part, some pharmacoeconomics part, everywhere, and it's quite interesting. Not only for the teachers, but you have to make it interesting for the student also, and it is our duty. We have to deliver it properly. It's an I think we have some time limitation, and
Yeah, yeah.
it's a very nice discussion and a very constructive and positive discussion about the social pharmacy theory. And I am very much thankful. I personally and on behalf of the entire team of the Pharma Law, Dr. Rajvedya sir, Dr. A.V. Yadav, Dr. Professor Gopal, Dr. Neeraj Upmanyu, Dr. Saurabh Kose, you have spared your valuable time around 2 hours for the constructive discussion for the benefits of the students, for the benefits of the academic community. It's a very good sign to discuss about some fruitful talk about some fruitful things related to the education. And we are talking about the new education policy, and the rationale of the new education policy is we have to talk and discuss about the some new uh, talk, some new theme, now some new topic for the social benefit. And once again, thank you very much. And tomorrow there is another panel, another panelist, another moderator. They will discuss about the social pharmacy practical, and I hope it will be fruitful for you also. And it's very honor for us on the auspicious occasion of this Saraswati Puja and the Vasant Panchami. We have a very eminent and experienced guest faculty, and really, I personally feel very great to interact with such eminent personality, including our dynamic our Saurabh Kose and the Neeraj Upamni. Thank you very much, sir. Thank you very much.
Thank you. Thank you.
Thank you, sir. And
Thank you, sir.
your moderation, sir, today was very wonderful, and definitely you have worked very hard for that. And sincere thanks for your, sir, all grinding questions coming from students, staff, and making it on a very good platform in a proper manner. And especially, I would like to thank Rajveddi sir and Yadav sir, Gopal sir, and Upanyu sir. So I have learned today
Yeah,
also,
yeah.
and definitely in the future. Thank you so much.
And I would like to also thanks to our coordinator Amit Jhaji. He continuously motivated us, inspired us. And he is not from the pharmacy profession and not from pharma background, but his interest. He deeply involved in the pharmacy, and that's why
Exactly.
our ex Vice President of Pharmacy Council of India, Professor Sailen Saraf sir, honored him as an honorary pharmacist. And it's a very proud moment for us because we are a whole actually a member of the Pharma team. Okay, thank you, sir.
Thank you very much. Thank you, one and all. It was an